Autism spectrum disorder affects about 1% of the population worldwide, and children with this condition, they face unique challenges that can impact their health. In this video, I'm going to cover some of the benefits of different types of exercise in this population, and I'm also going to share some key insights from an exercise physiologist who works with this population on a regular basis. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. Autism spectrum disorder is a neurodevelopmental condition that's characterized by unique challenges with social skills, communication, sensory stimuli, and repetitive behaviors and interests. The most recent estimates, so 2022, suggest that autism affects about 1% of the world's population, as I mentioned earlier. And even though boys tend to get diagnosed more frequently than girls, girls tend to mask characteristics and present differently, and therefore they may be underrepresented. Recommendations for improving testing in girls were published in 2024, and they focused on expanding the types or broadening the types of behaviors that are looked at, taking into account masking of characteristics in girls, and also, if a mental health condition is present, ensuring that that condition doesn't overshadow the autism diagnosis. Higher BMIs are common in children with autism, and if this persists into adulthood, they're more likely to develop other health conditions like type 2 diabetes. This is why it's really important that we have evidence-based practices in place to support children with autism in being physically active. When working with children who have autism in terms of working with them in sport and exercise, some characteristics that may be present, not in all cases, but in some, is that they may have challenges with maintaining attention, they may have challenges with emotional management, and then also performing gross motor skills or some gross motor skills as well as coordination. Now, challenges with motor control, coordination, balance, this is termed dyspraxia, and it's a separate diagnosis from autism, although it is commonly seen in autism. Autism is a very complex condition, and there may be challenges across different domains. Every child is going to be different. Exercise can help to relieve some of the challenges that children with autism face by improving brain function like memory, attention, self-control, and inhibition. In exercise and sports programs, these can offer unique social interactions that promote multisensory experiences. Physical activity and certainly sport, they can be more challenging for children with autism because of common requirements of motor skills like coordination and balance, communication, and also sensory stimulation.